Well, hello once again, and welcome to the Mental Health Show, where obviously we talk about different categories and subcategories with mental health. I'm your host, David Burrows. This is episode number 8, and we thank you for watching. We know we've been getting some response from those of you watching, so thanks for that. And another episode here today, and I say it every week, I'll say it again, I am not the expert, but we do bring the experts here to you. And Jennifer Zimmerman and Laurie Roeszler, thank you for being here, ladies.
Thank you.
Glad to be here.
Jennifer, I always like to give our folks some background on our experts. So we'll start with you. Tell everybody what your role is at Ckcs Open Minds and your background.
Hello, everyone. I'm Jennifer Zimmerman. I'm an RN at Ckcs Open Minds with the early intervention team. So I've been a nurse for a little bit over 5 years now, so I don't know about expert, but I got some information for you. But yeah, so I've been doing mental health nursing since graduating. So that's been my area of focus for this whole time. I was in the acute setting, now I'm in the community setting. So I've got some different aspects to that. And I just help people with their first episodes of their mental health and help them with education on medications and symptoms and bridge that gap between knowing where to go for help and finding out how to talk to your psychiatrist or how to talk to your parents if it's a youth. And then when the parents look for help, we send them to Laurie.
Very good. Well, Laurie, let's come over to you. Laurie Roeszler, Ckcs Open Minds, your family navigator. Give us your background and what does that title mean?
Yes, so hi everyone. Family navigator, and there are 2 of us here that work part-time. We give peer support to family members, whether they're parents or grandparents or a spouse or siblings, those individuals whose loved ones are experiencing mental health concerns, supporting them in their journey and recommending some community supports that might be a good fit for them. I come to this role as a result of having a loved one with mental health concerns 7 years ago. And so I'm not an expert either, as Jen said, but I do understand the journey that families find themselves on from an emotions perspective. And if it's specific to our loved one's diagnosis, I can offer some help specific to that diagnosis also.
All right, very good. Well, you don't give yourselves enough credit compared to me and probably the rest you're watching. You are the experts here today, so we're counting on you to give us the information we need. And information is really a big part of handling mental health, right? All the different topics that we've talked here about on the Mental Health Show. But Jennifer, I'm going to start with you because this is one actually, as I was preparing for today, it kind of intrigued me, medication. There's got to be a lot of different options available, and talk about some of those different options that are available with mental health and medication.
Mm-hmm. So that's a big thing that we are here to help with, is that medication education piece. So a lot of people are entering the mental health system kind of for their first time, and they're not really sure what medication will work for them or how to even go about getting a medication or talking about that medication. So definitely they come see us here and we sort of connect them with our psychiatrists, and that's the health team that's going to be the one prescribing that medication. So we're going to assess the symptoms and work with the psychiatrist and figure out what medication works best for each person. There's tons of different medications, so it's really a process of finding out what symptoms match which medication and what medication works best for you, that kind of thing.
Right.
It's very different.
Yeah. And you hear that word process a lot. And I'm curious, is this I would imagine, a lengthy process? It's not just let's sit down and have a little chat and, I think this, right? Can you kind of take us through the process a little bit?
Yeah, for sure. A lot of kids will come into Ckcs and say, well, my friend's on this medication. I think I want to try this medication. It sounds like a good one. And that's great. I'm glad that medication is working here for your friend. Maybe it will work for you. But there are a lot of medications in the mental health world. So definitely we're going to find out what type of symptoms you're having and what medication class you're looking for, an antidepressant, an anti-anxiety med, an antipsychotic med, maybe an ADHD med to help with focusing. And then you have to start trying them. So once you start trying them, it's not guaranteed that the first one that you try is going to work. And they also don't start working right away. So you have to give it like 6 weeks, a little bit of time, kind of navigate to see how that med's going to work for you. And if then it doesn't work for you, then you have to try something else and kind of play with it a bit until we get the right fit.
Isn't it interesting how you said, you know, if we had a youth sit down in front of me and they say, my friend uses this, they're very knowledgeable, or maybe, you know, like there's access to all this information. Do you find that when they're sitting down in front of you, maybe sometimes they've already, you know, they've done the Google and trying to figure out what this medication and that medication does, and then having to re-educate them?
Well, definitely we want them to know, right? You want, like, I'm glad that people are Googling. I'm glad that people are using that knowledge that's been put out there. I think that sometimes mental health, some people might put it in a one size fits all without talking to professionals. And that's not how it is, right? Everybody's brain is completely different. So medications are going to work completely differently on different brains. So their education that they have is real, like that medication works on depression. However, does it work on your depression? Right. That might be a difference.
Yeah. And then I imagine side effects is something that, you know, one pill does this and one pill does that, but then it can cause it. Like, it's a real complicated thing to deal with. By the, you know, and then you get big words thrown in there and everything. Take us through, you know, possible side effects and how does you know, maybe the youth handle that?
So all medications come with side effects. However, these newer generation medications have been made to kind of minimize those effects, right? So the reason that we will start a medication at a very low dose is to make sure we're monitoring those side effects, which is why medications take so long to actually start getting the best effect, because we'll start at a very low dose to kind of make sure the side effects are managed and gradually increase it to the correct dose that's going to work for you. And that really helps with those side effects. Another way that we can help those side effects is sometimes drowsiness is a side effect, and that's a pretty common side effect. And taking your medication at a specific time of day can help with that. So if you take your medication at bedtime, you're going to sleep through that drowsiness side effect and get your optimal effect when you wake up in the morning. Or sometimes you have a side effect of nausea with your medication, and that's just because you should be taking your medication with your biggest meal. So sometimes changing your medication time from 8 a.m. to supper time is the best way to take your medication because you're taking it with your biggest meal. So there's definitely lots of like hacks, you could say, to kind of avoid those side effects and get it to something that's more manageable. And I think the key thing here is that it is more beneficial to live with a mild side effect than to live with a severe mental health issue. You're going to have a better quality of life on that medication than if you were to just try to suffer through your mental health.
Okay. Now, I imagine like not all situations require medication. So how does it get decided, or when does one really know that they need to use medication? What situations would use that?
Yeah, so definitely. So there's tons of variety of mental health issues, right? So you may be coming in with some anxiety, and that anxiety could be situational. So there's even the chance that you might be taking your medication short term. And then you're going to be transitioning into something that's going to help you long term that's not medication. So that could be some CBT or DBT counseling, which is skills-based counseling, which is going to teach you how to manage your mental health issues and give you a toolkit of things to work with. And then there's cases where you don't even need a medication in the short term and you just need that counseling and talk therapy or even just a friend to lean on. And your symptoms seem to get better there. But when the medication becomes necessary is when those symptoms start interfering with your ability to interact with your daily life. So if you're not able to get out of bed, if you're not able to go to school or work, if you're not able to participate in your daily activities that you normally do, then it might be time to think about taking a medication to help you get back to being able to participate in your life.
Yeah. And that, well, you mentioned school there with the age group we're talking about. That would be a common thing, I would think, to, I got to get to school and I just can't today for all the different reasons. So medication's a part of all of this, or can be. And then we talked about side effects and the process. But let's talk about the early intervention side of all of this, like sort of define what you mean by that and then how that's handled.
Yeah, so research suggests that longer durations of untreated mental health ends up with poorer outcomes. So studies show that intervening early will help decrease the damage to your psychological and social developments. It'll decrease the interruption in school and in work. It'll reduce your suffering. It'll decrease your damage to your social support systems. And limit your exposure to physical dangers, such as substance abuse from suffering from your mental health issues for so long.
Right.
Or even early intervention will decrease your risk of suicidal thinking. So that's why early intervention is really very important. The earlier you can seek supports, the less damage your mental health, sort of anything that you've encountered with your mental health is going to damage your life and your social development, right? So the earlier we intervene, the less damage you're going to encounter. So your outcomes are going to be better earlier.
Okay. So early intervention is a good thing, but how do we intervene? I mean, sometimes, a lot of the discussions that we've had here on the Mental Health Show is recognizing symptoms and but approaching that, do we as the parent, or is it a friend of the same age who might be going through the same thing? But sometimes can that be hard for someone to intervene and say, hey, you need help, or help you recognize you need help, or yourself recognizing that you need help?
Yeah, so absolutely anybody that's in your circle can refer you. And of course, that doesn't always go as far as you want it to go, but at least that first connection, that first conversation is happening. So maybe your mom calls Access and says, well, I think my son or daughter really needs someone to talk to. We get that initial kind of setup and we see where it goes. The person who's been referred comes in, kind of says what's happening, decides where they want to go, right? You got to meet people where they're at. So at least showing them the door helps them get where they need to be. So mom, teacher, brother, friend, swim coach, anybody can say, hey, this is a place for you to go. Would you like to meet someone here and just talk? So definitely anybody can activate that early intervention. And definitely it is, anyone can walk in. Like there's no barrier. The door is open.
You don't need a doctor's referral either, right?
No.
I think it's one of the great things about the program too. A lot of the programs and resources is, and let's remind everybody, for those of you who are watching, we have to say it every week, these services are free and available, which I think is probably, would you say that's a question that comes up in people's minds? They go, well, I recognize I need some kind of help and support, but I don't have any money, or it's going to be too expensive. Is that often something that comes up? Yeah,
that comes from the parents. The kids don't seem to think that way.
Right.
They just want to come. But yeah, parents do often ask, like, is this insurance covered, or is there an out-of-pocket fee, that kind of thing, which there's not. It's totally OHIP covered, like you're welcome to come.
Right. That's got to be a bit of a relief in the whole process for parents to go, okay, we can get some help. I don't have to worry about the money, because especially right now, with the situation with COVID-19, money's a little different for a lot of people. So what's interesting, the combination between, everything you talked about with medication and side effects and early intervention, and I can see, early intervention probably some advantages, but can you kind of explain, like, why is early intervention so important in all of this process? Like, the earlier the better, I guess.
So I know you had asked earlier, like, what do people see that they would notify early intervention? Right. So we'll go back to that. So sort of like when you're starting to see some youth withdraw, sort of take away from their usual activities. Maybe they were really into basketball and they had a core group of basketball friends. And now all of a sudden they're staying in their room and they don't want to go to basketball. And they don't want to call their friends. And they're coming home right after school and going straight to bed. And they're not talking to mom. They're not talking to dad. They're just really withdrawing. So right there, you're not necessarily thinking, oh, they're really depressed, but there's a change. And so they could still be talking normally. They still could be functioning at school, but you notice a change. And so that change is the early warning sign. And you can see there already, it's going to impact their basketball. It's going to impact their social skills. It's going to impact their ability to progress with their friends and keep those friendships. So if we intervene early and we can notice that, hey, there's been a change here, let's see why. We can get that kid back to those things that are important to them, back to getting good grades, back to getting to basketball, back to getting to their friends, so that their life isn't as disrupted as it could potentially be if their mental health is left unchecked.
Right. So I guess one of the other things that I'm what's the word I'm looking for? I kind of crossed my mind. I wondered about. Yes, thank you. Is there a common obstacle in all of this? Is there a one thing that sort of stands out of a common obstacle to the support of what a person or your youth in this case needs?
So a lot of people will say, I don't want counseling.
Right.
That's a pretty common thing to hear. Like they think pretty poorly of it. I don't know exactly why. There's a lot of stigma surrounding mental health still.
Well, that's this thing, right? The stigma. We got to stomp that stigma out.
Yeah. So a lot of kids are saying, I'm fine. There's nothing wrong with me. I don't have a problem, which we recognize. You don't have a problem. There is nothing wrong with you. You are normal, and everybody has issues that come up in their life, and that makes you human. Yeah. So that is sometimes the barrier. But if we explain it that you're not coming for counseling, you're coming to find out the best way to get back to you. Like, I personally am not a counselor, I'm a nurse. So I can help people navigate their medications, their psychiatrists, that kind of medical aspect, and give education on diagnosis if they do get a diagnosis. And then we have peer navigators, which kind of separate from my role here, but those guys are just their peers that they come talk to and get it off their chest. And that's part of the early intervention, really, just kind of getting in and being like, well, I don't want counseling, but this is what's happening.
Yeah.
So that's kind of a barrier. People are concerned that they're going to be labeled or that they have to fix something that's wrong. And that's not necessarily the truth to it. It's more of, let's figure out how to get you to your best self.
Yeah. And I that's a common thing that's been brought up in all these conversations is, I say stomp the stigma, but that's seems to be one of the common things is, well, that's not me, or I don't want people to stare at me, or whatever the reasons are that we unfortunately still as a society, I think it's getting better because of things like the mental health show and what we're doing here and talking about it. But it seems like that's really the biggest part in all of this is to just start talking. It's all inside there, and it gets built up. And especially, like, I remember what it was like when I was a teenager. I can imagine being a teenager or youth now today. There's so much information being absorbed and pressures, etc. And I guess everybody, has a different comfort level on talking about their feelings, etc. But is that really is that one of the main keys in all of this? Is let's just get people starting to talk about it?
Yeah, and I think part of that even goes to Laurie and the family aspect of it.
Yeah.
Sometimes mom and dad are even not sure about letting their kids come. Mom and dad are sometimes even wary of like putting their kid into that mental health world, but it's like it's not a separate world. It's where we all are. We all have
Right.
mental health, and so I'm sure Laurie can speak to that.
Well, you're very good because I was kind of getting ready to lead over to Laurie there. So that was good. Thanks for that, Jennifer. And Jennifer, we will come back to you with some other questions. But Laurie Roeszler, thanks for sitting here and listening with us. This is really curious to me as well, because we're going to talk about the sandwich generation. I've never heard of that term before. Tell us, what is that?
Well, so the sandwich generation is, I guess, a generation I'm in right now, being in my early 60s. And that is where we have loved ones in our family, children, whether they be adult children or not. And then we also have parents that might need our time and our care and our energy as well. So that creates quite a challenge for families. I mean, navigating one of those worlds is exhausting enough. When you think
Right.
you have to learn the diagnosis, you have to learn the pathways to care, you have to find out the supports that are available, and all the communication that's required between you and your loved one, be it your dad or your son. And then also talking with healthcare providers that are on the care team. I mean, it's just a lot on parents' plates. And you know, when you're in your 50s and 60s, you know, we are unable to juggle as many balls as we once could. We have to kind of come to terms with that we have our limits. We have places where our elastic band is so stretched that it could snap. So we need to see that in ourselves, that just as if our loved one had cancer, we would maybe take some time off work. You know, rightly so, when our loved one has mental health, it's wearing on families in the same kind of way. And especially if you have a parent too, that you're part of the care team for that parent too.
Yeah.
So,
the word overwhelming comes to mind, and I would imagine being overwhelmed. Does this situation occur kind of overnight for someone? Like, does it show up all of a sudden, or is it gradual?
I guess it can in some cases. A lot of times parents can reflect back and see how, you know, they were seeing some anxiety, they were seeing some withdrawal from social situations like Jen pointed out. They can see some times where they were really curious about what their loved one was saying. In the case of maybe psychosis, severe mental illness, when they were maybe picking at their face as a little child and now they're cutting, you know, so sometimes you can see those symptoms early on. And sometimes, I guess in some instances of psychosis, for example, it can be a psychotic break, a sudden psychotic break. Yeah, I'm not, you know, I'm not a counselor or a nurse, but I mean, sometimes we do see these things and we address them at the time and come to find out years later that, oh, it was actually pointing to some more serious illness.
Right.
And so that's where having a team of support really helps. So having a peer navigator or having a family navigator that families can go to and say, this is what's going on in our house with our loved one. And we're exhausted. We don't know what is going on. And, you know, we know that by the time they come to us, they've already been struggling a long time. And so we can reassure them that there's help for them. As family, there's help for their loved one, and that this is a great place to start at Access Open Minds, and that what their loved one's experiencing is actually a thing. That's very comforting to families to know there are other kids out there with similar challenges. And so, yeah, we just kind of reassure them that better days are ahead and they've come to the right place, and we navigate them from here. So we kind of are the wraparound care that families might be looking for.
I imagine in all of this too, well, we talked about being overwhelmed. There's probably some unique challenges that come along with this. Can you give us some examples?
So some unique challenges in the sandwich generation?
Yeah.
Okay, so navigating the two worlds is a is unique to being in the sandwich generation. Also, being part of a team. The challenge of you can't do it all yourself as a parent. You can't do it all yourself as a daughter. And so try to be part of a team, whether it's siblings kind of get on board and the spouse in the case of your child. And in the case of a parent, for example, sisters, brothers, aunts, trying to be part of a team is really crucial because we will burn out in the long run if we're trying to manage all these pieces ourselves. And the other challenge is sometimes parents think they know the solution.
No.
Come to find out. And sometimes just saying, like I remember saying to my dad, how can I help you, Dad? Like he had a care team around him and my sister, but I said, what's helpful for me to help you with? Because he's not looking for me to do all those things for him. And my sisters have taken care of some of the pieces. So what can I do? And it might be as simple as, I would love a phone call. You don't have to come in person. And that takes a lot of pressure off of us when we think that we know what help looks like. We just ask. And sure enough, they know. Like when my father-in-law was in hospital, he just said, having a Tim Hortons coffee and you bring me a paper every day, that's amazing. So, that was easy. It doesn't have to be something that exhausts us, in other words, because we have a lot on our plate. The other challenge is observing our own limits. I facilitate a family connections program for families. It's a course actually. And observing our limits is really key because we need to see where our elastic band is being stretched too far and not only observe it, but then know how to set our limits, how to say no, and communicate that I'm just not physically able to do such and such or give this much time or, we have to be honest with ourselves, and that's pretty challenging when we have two generations to kind of, care for, to kind of come alongside. The other thing too is that we also want to be careful that we have a small circle with whom we can share the details of our journey, because it really helps when others can come alongside us and validate us and pray for us and, drop off the odd casserole. Not that we're looking for that, but I know that, they do for us as we would do for them if they were in that situation. So just not forgetting that there are helps there for us in friends and family who are more than happy to help. So I guess just being realistic about what we can handle and what we need help with.
Yeah. I like the example of when you say you're talking about your dad and just ask. Because when does the student become the teacher, right? When do we, start to, I know if I do that to my dad, it's like, whoa, look out. Like, don't tell me what I need. I'll tell you what I need. Right. And we all nobody likes to be told anything, but we love to give our opinion. So let's ask for what you would like,
Yes.
So, and that's really just a simple little thing. And I think when we're telling somebody to do something, we mean the best in doing that. It's just our language, right, that needs to change a bit.
Yes, I kind of liken it to a two-step dance on the dance floor. One person has to be the leader and one person has to be the follower. So in my case of my dad's Parkinson's, as it was progressing, I just decided that I was going to be the follower in the two-step. And I would always ask Dad, well, what would you like our afternoon to look like? And I always just let him come up with the ideas, let him lead. And that seemed to be, that worked better, because when I tried to recommend something, sometimes it was like, no, I don't need that. So it was just easier to be able to gracefully pass him the baton, right? And see what he needs help with.
Yeah, that language too. I've always, maybe not say, what you should do. How about, I have a suggestion. Would you like to hear it?
Yes.
Sort of asking for permission.
Yeah, it makes a lot of difference. In Family Connections, we say whenever you use should or shouldn't, you're using a lot of judgment And judgment is never good. There's a lot of suffering with judgment. So we always say, stop shooting on yourself.
Right.
Right. As a reminder to stop suggesting.
Yeah. Well, you sometimes you hear that too. You know what you should do? You know what you should do? Right. Stop telling me what I should do. Right. So, and these are just, it's interesting because these are just tiny little habits and ways to handle the situation. And I guess this kind of comes into self-care as well. Give us some self-care tips and on how we can do things.
Yeah, so self-care is a really big message that myself and the other family navigator give families, and also a big skill in family connections too. So, so in our case, prayer was paramount, having other people pray for us. And it was really neat to hear a local physician who's now moved to Hamilton tell his colleagues to include this question in their notes. Ask the patient what spiritual supports they find are helpful. So it's really good to see that the spiritual part is considered really, integral in self-care. We have the right to say no. We have to admit that we're gonna lose our cool sometimes. We have to admit that and apologize. Be gentle with ourselves. Be gentle with others. We can't solve our relatives' problems. This is a big part of the journey. The radical acceptance of it is what it is, and we can just support them as they go along in their journey. I found in our journey, I had to cut my schedule back to only the necessities because I just couldn't physically and emotionally do it all. And so, sometimes you have extra meetings that, other people are there. I'm not the key player here, so I can let that go. The other thing is introducing mindfulness into your routine. Staying in the present is part of mindfulness, which really helps us not to dwell on the past, maybe feel some guilt that we intervened earlier. Or we also then, if we stay in the present, we're not thinking of the future because we're always looking at that from a worried perspective, right? Ask for help from others and accept help being offered. I always say, look at that as a gift. Build some space into your day where you can go for a quiet drive, have a bath, do whatever gives you joy and rejuvenates you. That's part of self-care. And as you said, doing the little things can have big effects. So making sure we have good sleep hygiene, powering off our devices, a couple of hours before bedtime, setting our limits that, you're not responding to your loved one's needs between certain hours so you can get a good night's sleep, eating well, avoiding too much sugar or caffeine, exercising, and just moving. It doesn't have to be chronic or not chronic, but doesn't have to be intense. Journaling, if that helps, I find that helps for me to get my feelings out onto paper. I can kind of leave them there. Remaining hopeful is something that is part of self-care because life is difficult when families are in this journey, but this too shall pass. And better days are ahead, just like better days were before. There's a really great texting program called Text for Help, and it appears on your phone every day. And it's a hopeful message, which really does help every day to have that hope in your back of your mind. And then you're able to pass that hope on to your loved one too. They need hope as well. Focus on being grateful. There's always parts of our day that are amazing. Let's not forget those. Gratitude Garden is a free app where you are asked to enter 3 things you're grateful for that day, and you earn points to put towards putting insects and animals into.
Sorry, what's that called?
It's called Gratitude Garden.
Okay, I got to read that down.
It's a free app, and a girl in her 20s actually told me about it. So I thought, well, if a 20-year-old girl thinks it's cool, then we can all benefit from it.
Hey,
I did the whole thing and loved it. I was really sad when the program was over, but it was really helpful to remember, hey, life is hard and life is also still great. And that helps us get through those rough patches.
Absolutely.
Be gentle with yourself. We're all doing the best we can. Your loved one's doing the best they can. We're all in it together. reach out for help. You know, we offer one-to-one family support here, or there is Hope House in Chatham as well, who has a family group monthly. Let me think.
Well, there's before you just carry on there, I just wanted to kind of go back to one of the things you said about, talking about self-care is knowing when to limit ourselves, right? And when I was just about to mention it when you said it, that guilt thing. We feel guilty if I had to do it with my mother a few years ago, right? She's in a nursing home now, but I work and she would call at it was always the most inconvenient time. And right. And then I felt guilty for even thinking that my mother was inconveniencing me after all she did for me, and all those things go through your mind. But I did have to say, it's Mom, from this time to this time, if you call, you're welcome to call, but I'm likely not going to answer. Mm-hmm. And that, that took some adjusting on my end, but she had to get used to it at her end too, because it took me some time to go, her world is really different and it's about this big right now. And how do we deal with that guilt? I still get a little bit, I'm like, sorry, but I got to go to that appointment. And I don't want to sound like that cat's in the cradle, right? But can you offer some suggestions on the best way to deal with that guilt?
Yeah, it is somewhere where parents go. I think naturally we're wired to reflect and look back and, I should have. There's that should again. Yeah. I could have. And we, in our Family Connections class course, we say you did the best you could at the time. And that's important because at the time we made the best decision we could with what we knew. And as we learn more, we do better, and our best we can now that we have some tools is better than it was then. But we can't help that we didn't have those tools then or that knowledge then, because it's a journey for us as family members too. We have our own emotions about what our loved one's going through. We have our own emotions about what we're going through. How, wow, I didn't picture this for my adult life, for example. And so we just have to say we did the best we could, all of us. We're in it together. We're in a better place now because we know more. And our hearts are in the right place. We love you. They love us. And I think if we just always return to that place, then we're a team. We move forward together. Yeah. Right? We move.
I'd love to add on that team part. So like you're saying, you guys make time for yourself. But something to add into that is when your youth maybe is asking for you to do all these things for them, or they're unloading on you and you're feeling like you need some time for yourself, the team, right? So get someone on your team, come to Access, get someone else for your child to talk to. And I mean, there's adult supports too. Get someone else for mom to talk to. Add more people to your team so you're not carrying the whole load.
Mm-hmm.
Yeah, because that creates just kind of adds more weight to what you're already trying to deal with. It's like putting some more rocks on your shoulder, right? It's going to hurt after a while, and that strain. And I guess if we take these things on ourselves for too long, that can really have a long-term effect on our own mental health now, right?
Absolutely. Some family members come in and they haven't been sleeping well, and we can just make them aware of that, because sometimes when you're in the thick of things, you're not thinking of these obvious things. You need to be reminded. Sometimes families need some supports around some anxiety medications for themselves, or some stress management, yoga, mindfulness, prayer. I mean, just taking time to be still. We don't think of that when we're in the middle of this journey. And so just these reminders from the team, like Jen's team that are clinicians, or the reminder from a fellow family member, just to don't forget this and don't forget this. These are so important. And we do forget them because we're focused on caring. So,
yeah. And, we all have those different personalities. I mean, we could talk about, the 4 basic personalities, whatever, but all those different personalities, for example, like I know some people, like they just do all the time for everybody else. That's just who they are, or they're the go-to person that everybody goes to all the time. And sometimes do we have to change our personalities a little bit? Or are we adapting our personalities to, if I'm the one that's giving the help all the time, and now maybe I'm the one who's needing to receive that help, I might really have a hard time with that, right?
I think remembering that it's their journey is number one, because then it takes the onus off us to do. We just come alongside them, and that frees us of thinking if it's not us, that it's not happening, because we're just one of many supports. And just, like in our Family Connections course, for example, sometimes on the last day, like of the 24-hour course, on the last 2 hours, some families kind of come to that aha moment that, okay, so my loved one, this is their journey and I can't fix it. I can just be their sounding board, their safe place to whatever, to talk to, or, and that really, it's better for everybody when we can keep it in balance, whether we're a doer or whether we're not. We have to keep ourselves balanced. Our needs, their needs. Our goals, their goals. We have to manage it.
Yeah, it's hard. It's hard to draw that line, right? Because we love somebody so much. We just want to fix it, and we just want to. I would trade places with you, or whatever that is that to do. You talk about the word team in there. I'd like to talk about the mental health first response team that's available. Who wants to kind of give us some more information on that?
I mean, I think both of us could speak to it because it is available to both sides, right? Our people that are our youth that are the ones you're supporting with mental health, they're able to use the first response team. But I mean, the parents are also able to use the first response team.
Oh, okay.
So our youth, let's say that they're having a crisis and their regular workers are off of work. So maybe Access Open Minds closes at 5 and they're starting to have their panic attack at 5:30. They can call mental health first response team, and they're there 24/7 to kind of be on your side. But let's also say a parent is having trouble and they don't know how to help their child. Now the parent's having a lot of anxiety. They can also call first response team.
So there's this is fantastic, but what can you give me kind of a difference between this and say Kids Help Phone?
So Kids Help Phone is for ages like the younger ages up to 18.
Okay.
Whereas first response team is from 16 into adulthood. So that's why we can use it for parents and our youth. So 16 and up is going to call first response team, and 18 and under can call Kids Help Phone. Similar sort of things. They both are crisis lines. However, I do tend to tell people it's not like I'm in the worst crisis of my life, I can only call then. It is, I need help right now and I need to call someone now. So that could just be, I'm having trouble getting up the courage to go to work right now and my normal everyday person is done and I need someone to call. You can call first response line. Like maybe you're not in a life or death crisis.
Help me through the situation that I'm dealing with now.
Yes. And they'll answer. It's 24/7. They're there.
Wow. That's amazing.
Yeah, and I tell parents that as well, that they're just waiting for you to call. And that sometimes they can navigate the family to a service that, maybe tomorrow go to Access Open Minds, or they have a community list of family support. So they can say, there's this week, there's a family circle group at Hope House. You might be interested in that. So they not only get you through the situation, they can also navigate you to some supports for yourself. And the other thing I want to point out is that since COVID, Kids Help Phone has a 24/7 text support for parents, which is amazing because some people would prefer to communicate that way versus calling in. So we're very thankful they've added that option too for families.
Yeah, that's come up regularly, actually. So it's obviously a service that's being used, and we got to adapt with the times, right? Hence here we are having this conversation remotely, and let's talk a little bit about that on both sides here, ladies. how are the services being handled right now? Or is it all virtual? As things change, is it walk in? Jennifer, let's come back to you and let you start with that.
Yeah, so we have both options right now. Access Open Minds, our doors are open 5 days a week, 8:30 till 5. However, you can walk in, but we do prefer if you would call us so that we can do some COVID screening questions before you do come. But let's say you just are kind of in a state where you just need to walk in. You can't manage a phone call. You can walk in 8:30 till 5. I'm in a room. I can show you here. We have our plexiglass set up.
Oh, there we go.
Can you see it there?
Yeah.
So our rooms don't have our usual furniture in them. Everything is wipeable. We've got plexiglass on our tables. Everything's able to be disinfected. This is the movie room, so we've got our movie posters.
I was going to say, is that Iron Man behind you?
That's
there?
Iron Man.
Oh, yeah, right on.
Into the movie room. There's some reels on the wall there.
Cool.
Everyone's going to be dizzy now. But yeah, so basically, if we're doing appointments, we're going to call, we're going to screen your COVID questions. Everyone has to wear a mask nowadays.
Yeah.
And then we've got these nice rooms set up. But if that's not where your comfort level is, we can also do video calls just like this.
Okay.
We can also do just on the phone. We also have the ability to email and text. So there's a wide variety of options to communicate with us.
Right. So whatever you prefer, pick up the phone, text the phone, it's all available. You say walk in. Can you tell everybody where you're located?
Oh, I am not great with addresses. Laurie, do you know the address?
I
think it's 140 King Street.
Yes. That is
right.
If you're walking down King Street, we're right next to the mall, and we have like green window coverings on like the front of our windows. So if you see like a green windows, that's us, and it's Access Open Minds right downtown next to the mall, sort of.
Perfect. Laurie, anything you wanted to add about the response team or anything with how you're handling folks and a little bit more, actually, if you wouldn't mind, on your role as a family navigator and how you kind of do that?
Okay, sure. Just grabbing my notes here so I don't forget anything. We offer the same kind of support that Jennifer outlined. So both Jan Bray and I, she's the other family navigator. We see families 1 day a week here, and then the other day that we work, we're from home, but we can, talk or text or email or do a face-to-face via Zoom meeting if that's preferable. And one thing that I've really appreciated with COVID is that now there are a lot of online supports for families that didn't exist before. So for example, our Family Connections group is now over Zoom. So in our current group, we have a mom from New Brunswick, and she said, I would have never been able to take this course because it's not offered in my community. So, I mean, a lot of people are being helped that might not have before because of
We're really reaching far.
Yeah, it's just amazing. Lots of really good things about COVID, if we have to look at the good side. And OntarioCaregiver.ca, they have an online group now, which they didn't have before. FAR Canada, FAR is capitalized. That's support for families whose loved ones have addictions issues. That's now remote. There's phone support or online support. Young Caregiver online support group exists for families that are between the ages of 15 and 25. So younger caregivers, now there's a way they can connect. So no one's left behind. That's one of the core messages of Family Connections. And I have to say that COVID has really enabled families to get the support they need when they need it. So really thankful for all those kinds of supports that have been put in place.
Yeah, and sometimes I feel families don't realize that they have someone that they can go to too. So a youth will come in and say, my mom's not really sure how to talk to me about depression, or dad doesn't really understand why I'm on a medication. And so I email Laurie, hey Laurie, I got someone that maybe you should talk to. The youth will go home and say, Dad, do you want to talk to this person? They come back, yes or no. And then Laurie is able to connect with them and give them that education from a parent or caregiver aspect. Whereas like the youth has their person, and now the family member has someone they can turn to as well.
Right.
And David, I have to also give a shout out back, because this is the value of being in a hub where we're all together in this. Physically, is that sometimes I'll see a family member before their loved one has agreed to get help. And so as a result of the family member reaching out and maybe talking about some symptoms, I can kind of talk to Jennifer or the other team members, say, this sounds like this person might be, looking at this down the road. And, it's an opportunity for families to say, if your loved one's open, have them come by. They can have a tour of the space. They can feel how open it is and youth friendly, and meet some of the staff who are amazing, validating. And so sometimes we can refer people to their program through the family who comes to visit us. So it works both ways. It's a beautiful way to tell everybody you all matter in this journey.
Yeah, right. And well, and you sort of read my mind there. Collaboration, really, and not just between the two of you, obviously, but other agencies. I imagine that you're working with on a regular, kind of all on the same page, all looking for the same results, right? You're talking with other agencies often, I imagine.
Yeah, so right here in Access, we actually have multiple agencies that use our space so that we can all be together. So I personally am a Chatham-Kent Health Alliance employee. So I work for the hospital in tandem with CMHA Access Open Minds, so both. And then we also have FSK, we have some ODSP help here, we have Chatham-Kent Children's Services, we have other CMHA workers here. We have caseworkers here. Like, there's a bunch of different mental health teams all in one space, so that you're not walking through a million doors. You've got one door that you're going to, and everybody's here that can help you.
Yeah.
We actually also have the school nurses on our team too.
Oh, wow. Yeah, because that would be like, I got to go over here, and now it's telling me I need to go see this person. Now I got to you got to get on the bus or get a ride or whatever. So it's just one hub kind of.
Yeah.
That's fantastic to be able to have that access.
Sorry, David. We have a weekly huddle as well, and it's of course over Zoom meeting. So as many community partners as can join that call. So it's a chance to collaborate with all those minds and to find, best fit for a client, whether it be a family member or a loved one, a youth on the journey. Right. So, I mean, and of course, there's collaboration every day as well, but the weekly huddle is really valuable. Right.
Well, a lot of information here today, ladies, and as I knew we would. That's why we got you. I'm still going to call you the experts. Don't deny it. And I guess one place to start is we got the information on the screen is just give a phone call or send an email to Access Open Minds. And then this is a situation, I guess, where Google can be our friend as well, right? You mentioned a lot of great online resources and apps. I'm going to go get the Gratitude Garden app there, and just, I guess in all of this too, we just got to breathe a little bit, right? We got to slow down. I think maybe COVID did that to us a little bit. Like, I call it someday showed up, right? And forcing us to be creative and, again, to be able to do these kind of things. And for those of you who are watching, take advantage of these services. They're there for a reason. They want you to they're waiting for your call, as Laurie said earlier, and no reason not to be able to reach out. Jennifer, I want to give you both an opportunity to kind of wrap things up if there's anything you wanted to add before we go.
I do just want to add that we do have Facebook, Twitter, and Instagram. So feel free to follow us on there if you want to see what's going on. We do offer some virtual groups right now. So there are other ways to get involved with Access more casually through groups. So follow us on social media platforms to find out what's happening.
Very good. Thanks, Jennifer. Laurie?
I just wanted to kind of outline two other apps that are helpful too. One is called Insight Timer, and it's a free app that contains some mindfulness medication apps for sleep or relaxation. And the other one is called Thinkful. It's a free app also that helps manage and understand our stress. We can record our current stress level. It gives us tips, gives us education around what we're suffering with. And I also wanted to mention that Hope House Mental Health Network has a warm line, pre-crisis support, Monday to Friday, daytime hours, and they also have crisis support. So they are also a really great resource for family members too.
Fantastic. I wrote those apps down. I'm going to check them all out. The other part I like about all of this, other than the obvious, free. The apps are free. Laurie and Jennifer are free to talk to. Access Open Minds I like that. Access Open Minds. Fantastic. And we're trying to continue to stop this of mental health, and we just got to keep talking about it and get us talking about it. And it hits me every week near the end of the broadcast. My first grateful thing would be to say how grateful I and many others are grateful for you and for all the services that are available out there, because it really does have a strong positive impact on our community and our youth. Fantastic. And thank you for, ladies, what you do in all of this.
Thanks for
having me, David.
You're welcome. Well, once again, it's been the Mental Health Show. We'll be back again next week. If you have any topics that you'd like us to talk about that we haven't touched on yet, in the comments below, make sure you let us know. Reach out to Access Open Minds. Once again, I'm your host, David Burrows, for the Mental Health Show. Until next time, take care of yourself and each other. Bye for now.